What's up, guys? How's it going? Cade More with More Muscle. Today we're going to be talking about something that's interesting: Hirschsprung's disease. Guys, this is where basically the body moves, poop out of the stomach, right? And basically one of the colon isn't fully formed, and it's very, very small, and that poop can't come out for those babies. This can, result in some serious problems. Um, and some risk factors are a family history of Hirschsprung's disease. What you'll expect to find is failure to pass meconium within 24 to 48 hours after birth. Meconium is poop, guys. Episodes of vomiting, refusal to eat. They're not going to want to eat because they have so much in their stomach already. Abdominal distension. So abdominal distension, you'll see like a bloated stomach. For an infant, you'll see failure to thrive, so they're not going to be progressing in life. Constipation, vomiting, episodes of diarrhea and vomiting. Child will be undernourished, anemic appearance, abdominal distension, visible peristalsis, palpable fecal mass. So you'll be able to feel, the poop in their stomach, which is kind of gross, but constipation, foul smelling, a ribbon-like stool. So what you want to do is you'll want to do a CBC, so get their current blood cell count, their blood electrolytes, and you want to have like a biopsy done to see if there's an absence of ganglion cells. So for this surgery, you want to prepare the family. You want to assist the family with nutritional, nutritional teaching, which would be high protein, high calorie, low fiber diet. But after the surgery, you want to have a high fiber diet. But just for right now, you don't want to have a high fiber diet. You kind of want to slow it down. And then, total parental nutrition will be, prescribed in some cases. Guys, TPN is a very expensive food that basically is just injected right into your veins. And it's very, very expensive. And this basically is like perfect nutrition that will just go right into your veins. There's a lot of people there's some people that have, stomach issues where they can't digest food properly. As people are prescribed TPN. So that's total parental nutrition. But anyways, there's gonna be a surgical removal, and there's gonna be a temporary colostomy. So basically what they do is a colostomy, guys, is kind of not the funnest thing, but they'll basically attach the colon, right? And they'll connect it to the stomach, and there's gonna be an opening, and that's where the poop is gonna come out. And then they'll have a bag around it to catch it. And then they'll let that bad part of the colon heal or, get surgically removed. And then they'll reconnect it. And then, pooping will be normal. And then after, you want to have a high fiber diet after that surgery. But you want to assess respiratory status, maintain airway, provide supplemental oxygen, provide, Foley catheter care, assess the bowel sounds, bowel function. You want to assess the client, make sure they're doing okay. And then you want to monitor for complications such as enterocolitis, and that's inflammation of the bowel. So you want to, resolve inflammation, prevent bowel perforation, and you want to maintain hydration. So those are all things that you can do that you want to make sure that enterocolitis doesn't happen, and you want to make sure you keep them away from incontinence, where you want to help them use the restroom properly and stuff. This isn't something fun to deal with, but if that's why a lot of times they'll monitor when a newborn is just born. They'll monitor if they've gone to the bathroom or not, right? Because if they haven't, that could be a problem of that colon being too small where poop can't get out. Anyways, guys, thank you for watching. Hopefully you learned something. This is Hirschsprung's disease, and it's diagnosed when they're young. So thanks for watching.